Welcome to another episode of my webinars where I will show you how to analyze the facial features and how to improve the profile and the relationship between cheekbones and jawline, nose and chin.
This is my young patient, 34 years old, who believes she has some issues with the way how her face looks in profile. Double chin, jawline is not properly defined, and also she complains on her chin, which is too short in her opinion. It's not often when patient sees the main problem clearly, but in case with this patient she is right. Let's have a look at her face. It's always important to evaluate the face from different views: straight view, 2/3, profile, and down view. And of course, it's better to make pictures before procedure for future comparison. According to ideal facial proportions, we can divide the face in 3 parts: from the hairline to eyebrows, from eyebrows to the base of the nose, and from the base of the nose to the base of the chin. Ideally, all these parts should be equal. As we can see on my patient, the lower third is her shortest part, the mid-face is her longest, so all 3 parts on her face are different. It means that we have to extend the chin and make cheekbone more prominent, adding some volume to make all parts equal. Also, within the straight view, we divide the face into vertical fifths, where each fifth being equal to 1 eye width. And again, as we can see, we need to extend the chin and make it more straight and narrow, cheekbone should be more defined, and the temple area needs volume too. It's also very important to assess the profile view. Let's measure the profile angles. With this angle, we can evaluate forehead convexity, which should be approximately 12-13 degrees of vertical. Typical female nasofrontal angle should be approximately 115 to 125 degrees. Typical female nasolabial angle is around 95 to 110 degrees. The desirable angle is usually 110-120 degrees. According to Schwartz profile analysis, angle of facial convexity excludes the nose. 12 degrees plus minus 4 degrees indicates a normal face. The angle of total facial convexity includes the nasal tip, 133 degrees for female patients. The labiamental angle gives a measure of lower lip curvature. It's reduced in the short face patients and increased in the long face patients, 120 plus minus 10 degrees. Lip-chin submental plane angle should be 100 degrees plus minus 10 degrees. In summary, the patient's nasofrontal angle and the lower lip to submental plane angle are increased, and the nasolabial and labiamental angles are reduced. That means procedure of slight elevation of the nose tip, chin beautification, and lower lip eversion is required. The Ricketts line is used to identify relational protrusion of the nasal tip, lips, and chin. The lower lip should be 2 mm and upper lip 4 mm below this line to create an ideal profile. In this particular case, the upper lip is touching the Ricketts line and the lower lip is about to touch it too. It means we need to extend the chin and slightly elevate the tip of the nose. The product of choice for these procedures is Allergan's Juvederm. I start with the first cheekbone point. You can see how the tissues can be moved here. In this area, the zygomatic ligament has its bony and cutaneous insertions. It's very important lifting point. Here we have zygomatico-temporal suture. Palpate the notch, pinch the skin together with the other tissues, pulling them away before making the injection. Inject the product deep on the bone and slightly medially to the origin of the ligament at the level of the notch. Usually I use 0.1-0.3 cc in this point. Release the skin, mold the product laterally. Then the second point slightly medially. Consider making the aspiration when inject again deep, then the third point in the same area. In total, in these 3 points I used approximately 0.5 cc of Juvederm Voluma. Now mold, and you will see the first lifting effect. With this technique, this is the part of Mauricio de Mayam Decords, we can support the ligament in this mid-face area. And as you can see, this volume restoration in mid-cheek also affects the lower third of the face, and we can see the lifting effect in this area too. Now I am injecting the temple area. You should palpate the artery first with your index finger, and then inject deep in the deep temporal fat. You should remember that the point of injection has to be 2 cm laterally from the lateral canthus and 1 cm up in the upper temporal compartment. I am injecting here 0.2–0.3 cc. You may notice the difference between two sides and great lifting effect on the treated side. Now the angle of mandibular. I hold the angle between the fingers and injecting deep to the bone, slightly above and medially from the angle itself. Usually I inject 0.2–0.4 cc of the product. You can see immediate angle definition and more straight jawline. The next point is located medially from the mandibular ligament. You should pinch the skin, pulling away the tissues laterally and inject down deep on the bone, 0.2–0.3 cc. Release the skin and mold the product medially, and you will see the perfect improvement of the jawline. These 2 points together give us visible result. And the chin. I use this point on the base of the chin to extend it and make it more balanced and proportional with the profile of the face. Usually 0.2–0.4 cc is needed for this point. Additional point can be the point from the below of the chin. I use it to narrow the chin and make it slightly longer. Finally, you can see the improvement of the rickets line. The desirable 4 mm between upper lip and the pencil is clearly visible, so the relationship between nose, lips and chin is perfectly balanced. And now, we need to add the product here to reduce the unwanted shadows and improve the labia mental angle. I will use the cannula here. Also, we can do the same with the needle techniques. When injecting the chin area, the mental artery and nerve should be avoided, so we need to remember that the mental foramen is located about 2 cm below the corner of the mouth and slightly lateral to it, approximately on the midpoint between upper and lower border of the mandible. Injection should be done subdermally to avoid complications. Normally, 0.3–0.5 cc of the product is needed. So we can see that lower lip is perfectly lifted, the corner of the mouth is slightly up, and unwanted shadows are eliminated. On the treated side, we can see that the tissues are better stabilized and jawline is more defined comparing to untreated side. And the nose. We need to elevate a little bit the tip of the nose and make the bridge of the nose more straight. It's better to use cannula, and injection should be deep to avoid complications. Augmentation of the nose can be quite challenging and lead to the high rate of complications. The most serious adverse event that could possibly occur during filler rhinoplasty is vascular complications such as skin necrosis and even blindness. Blood supply to the nasal dorsum is mainly provided by the dorsal nasal artery, a branch of the ophthalmic artery. The lower parts of the nose, including the nasal tip, the alar, and the columella, receive blood supply from the branches of the facial arteries such as the lateral nasal artery, the columella branch of the superior labial artery, and the inferior alar branch. Therefore, any inadvertent intravascular injection of the fillers at the columella of the nasal tip may also travel into the dorsal nasal artery, contributing to blindness as well. The plexus of vessels is located in the smooth layer. Safe injection technique should therefore focus on keeping the needle or cannula deep instead of trying to avoid specific vessels. It's better to use cannula, and you should be very careful and gentle while injecting. Fillers should always be injected slowly and under low pressure. Small volumes of fillers should be introduced with each injection. Dear doctors, I hope you were enjoying watching my masterclass, and you can see more masterclasses on my website, and I hope that it will be useful in your daily practice, and see you soon.